Here. Joining us now is David Glendenning, Education Coordinator for New Hanover Regional Medical Center EMS. Thank you, David, for being here with us today.
Thanks for having me.
So, you, in your job, have treated a lot of people, especially with heart attacks, correct?
Sure.
So, heart attack is the leading cause of death in the U.S., and I feel like we talk about the symptoms a lot, but obviously a lot of people still are not paying attention. Let's talk a little bit about those symptoms for heart attack.
Sure. The problem with heart attack is that it's just not a cut and dry, hey, I'm having a heart attack, your heart communicating with your head saying we're in trouble. Signs and symptoms can be a little tricky sometimes. Basically, you can have your classic chest pain, you can have a heaviness feeling in your chest, you can have pain going up and down your arms, you can have a shortness of breath, or you can have an unexplained breakout in a sweat kind of like state where people are just like, something's wrong, but I don't feel like it's the end of the world.
Yeah, those are symptoms that you could have from anything.
Yeah, it's usually subtle and it works its way up. So people have the tendency to kind of put it off and try and walk it off.
Okay, so working its way up, meaning those symptoms will come back and they'll be worse every time?
Well, it's unpredictable. Everybody is different. That's why it's so important to pay attention to your body. And when it says, hey, I'm in trouble, you know, you pick up the phone, you call 911, and you have the paramedics come out and check you out. Okay,
so is there any symptom that seems to be more common than others, or basically it depends on the person?
Well, men tend to be classic. They tend to have that abrupt chest pain, sharp pain right in the center of the chest, or heaviness. And women can be a little trickier. They'll actually have sometimes some discomfort in their abdominal area, like nausea, and then that sweat, and then it just won't be any pain in the chest whatsoever, and they'll kind of try to walk that off too and put it off. Again, don't ignore those signs and symptoms. If it's abrupt and it's not your body and it's not normal for you, pick up the phone and call 911.
Would you say that more people are listening to this advice, or would you say that we need to continue to tell people about this?
I think the public education has gotten better over the years. However, it still needs to continue to be huge. I think we're doing great, and we can definitely do better.
Okay, so when somebody calls 911, I mean, what can they expect from the EMTs?
So they can expect a prompt response. All of our paramedics are trained to interpret EKGs in the field and actually be able to determine whether or not that patient is having a heart attack, then and activate the cath lab at New Hanover Regional Medical Center.
Okay, so they probably shouldn't be afraid of calling. It's better to call and have it be nothing rather than having it be
We'd rather
something.
come out and check them out from head to toe, offer them transportation to the hospital and still play it safe than them not call at all.
Okay, and is it better to call 911 rather than going to the hospital yourself?
Absolutely. You call 911, you don't take the chance. You don't want to be driving yourself to the hospital.
Okay, well, thank you so much, David, for being here today.